coming up, we'll be on location at the Anti-Aging and Longevity Institute in Columbia, Maryland, discussing the latest advances in anti-aging, health and wellness, and how they can effectively help you look and feel younger, as well as improving your overall well-being with one of this region's top doctors, Dr. Nadu Tuakli. Dr. Tuakli received her master's in public health from the prestigious Harvard University and completed her residency in preventative medicine from Johns Hopkins University. Dr. Tuakli is also an assistant professor at Georgetown University and has well over 30 years of experience and is widely recognized as one of this region's leading doctors. Welcome, Dr. Tuakli. It's a pleasure having you on our program.
Thank you so much. Thank you for having me.
It's your first time on with us. We have a lot to talk about. We're going to hear from some of your patients a bit later as well. But I wanted to begin, if I may, because you are the medical director here at the Anti-Aging and Longevity Institute in Columbia, Maryland. You also have another second location in Laurel, Maryland, to make it convenient for a wide number of folks in the region and the community. You are certainly one of this area's top doctors in anti-aging and health and wellness. You have well over 30 years of experience. We are very proud to have you on with us today.
Thank you.
Because your institute and yourself offer some of the latest and most effective and advanced treatments, whether it comes to anti-aging, hormone therapy, as well as in weight loss. You've helped so many folks throughout the region that come to you. I wanted to ask you if you can tell us more about this, because you really use an integrative approach.
Correct.
And as far as the patients that you help them improve their appearance, their overall health and wellness. And I wanted to begin by asking you if you can please tell us, for folks that are watching, what anti-aging is and how it works and how it can benefit them.
Yeah, so you did a great job of explaining what anti-aging is, actually, because anti-aging is a science that takes all the technologies, the research, and the information that's available to extend life, improve the quality of health and wellness, and put it all together for the benefit of patients. So anti-aging is very holistic, as you've said. It encompasses a lot of things, but the goal is, the bottom line is, that we want to extend the lifespan, but also improve the quality of life. Because quite frankly, nobody cares about the numbers if they're sick, frail, and in pain. So we want to add quality to the life as well as increase the lifespan.
Yes.
Anti-aging is called a lot of different things also, which may cause some confusion with people. So sometimes you hear it called longevity medicine, age management medicine, life extension. But the bottom line is, it's all about extending the life, giving people wellness, health, vitality, and more years on the earth.
Absolutely. And we all want to live for many years. We all want to look younger and feel younger as we get older. It's like Ponce de Leon, right? The fountain of youth so many years ago. And now, as far as your anti-aging program is concerned, can you please tell us what that involves for folks watching?
I can. So anti-aging is revolutionary medicine, to be honest. It is the future of medicine. It's tomorrow's medicine. An anti-aging program looks at a patient, every aspect of them, and determines how we can make this person feel better and live longer. So there are lots of different modalities that can be used for anti-aging. For example, weight control, hormone balance. You can do long-term, short-term. Short-term, for example, would be you're on a trip to China tomorrow and you don't want to get sick when you're there. So you may choose to get an infusion of vitamin C or other vitamins so that you're not going to get sick. But that's obviously short-term.
Yes.
Long-term, we plan out how we can make sure that you live into your 90s, 100s, but at least be able to function with your activities of daily living throughout the time. Because there's no point being here if you're not enjoying life.
That's right.
And so whatever your goals are, we take this into consideration when we devise an anti-aging plan for you. It's sort of like how you devise a financial plan, or you go to a personal trainer. We figure out exactly what you should be doing and how we can improve on it and set you up for success, because a patient's success is my success.
Yes.
But anti-aging is a great field. I'm very passionate about it.
Yes, you are. You're one of the leaders in it, in fact, in this region. And I love the fact from what you just said a few moments ago, Doctor, that you really customize your anti-aging treatment plans based on each of your particular patients' needs, their goals,
Exactly.
To help really achieve what they're striving for.
Exactly.
And you utilize that holistic approach by looking at each of your patients as a whole, because after all, body, spirit, mind, it's all connected as one when we think about it.
It's all connected, and we want to hold on to it as long as we can.
Yes.
So I think that people think that anti-aging is the basic preventative medicine, and it is that as well. But what I don't do is give generic advice. Hey, stop smoking, don't eat any chocolate, go to the gym, work out.
Yeah, the basic stuff.
People know that already. That's not what they're looking for in an anti-aging program. What they're looking for is a program that is customized, personalized to them as an individual. I take a look at your health history, your genetics, your family, what you've been through, what your social situation is, what your goals are for the future. All this has to be combined in an anti-aging program and a plan for you as an individual.
Yes, indeed. And can you please tell us, Dr. Tuakli, what are some of the problems that are addressed?
Anti-aging basically addresses all the problems or the conditions that are associated with aging. So some people think it's normal to be fatigued as you get older. It's not. Fatigue, arthritis, dementia, no libido, erectile dysfunction, weight gain, depression, all of these are related to possibly aging, but they all have a cause, which we can rectify.
Yeah. Yes, indeed. And who would you say out there watching right now would be a good candidate for your anti-aging program?
Everyone and anyone.
Pretty much covers everyone.
It covers everyone. And one of the great things about my program is that being a board-certified family medicine specialist, I am qualified to see all ages and all genders. So I can take care of everyone.
Yes, absolutely. Now, how would the treatments be performed?
So it depends on which treatments you're referring to, because a lot of people are concerned about external aging as well as internal aging. And in anti-aging, we are concerned about controlling the visible and the invisible things of aging and the conditions of aging.
Yeah.
So obviously, if it's something to do with the external aging, we may have Botox, fillers. Oftentimes I focus on vitamins and supplements to keep you looking healthy. But for example, I have a lot of products that we use to keep the external looking good.
You have the latest and greatest when it comes to the external already here.
I believe so. And then, of course, there are weight control programs. So we have a program that you will lose between 20 and 40 pounds in 6 weeks.
That's a substantial amount of weight.
Guaranteed.
And I understand it's very safe and highly effective. In fact, we're going to hear from one of your patients a bit later on how much success he's had with that program.
Yes. So the treatment that we offer or the procedure that's done depends on what we're trying to achieve,
Sure.
basically. But it's always customized.
And you touched on the results a little bit. I just wanted to ask you if you could please tell us a little bit more about what your patients are experiencing overall when it comes to the results of your anti-aging program.
My patients do exceedingly well, and I have invited a few to give testimonials.
Yes, we're going to hear from them.
Which I haven't heard, but they do really well because the program is customized to them. So I look at every patient as if they're a piece of Swiss cheese. It's an analogy that I always use with my patients.
Yes.
So if you think of a piece of Swiss cheese, it has a lot of holes. And my job is first to determine what each individual person's holes are, and then we can work on fixing them.
Yes.
And even if you are able to close up 75% of someone's holes, so to speak, they still feel so much better than when they walked in the door. So it's not that I can 100%, I'm not a magician. There may be things that can't be done. But every single patient that I have in my anti-aging program, every bioidentical patient that I have is doing 300 times better than they were before they seen me.
And that is significant indeed. That's ultimately the goal when someone comes here, right? Is to feel better, look better than when they first came here.
And be well.
Yes, indeed.
Yes.
Now, for the folks out there watching, Dr. Tuakli, I wanted to ask you if you could please tell us what the process is from when a patient initially comes to you and your practice, the Anti-Aging and Longevity Institute.
So, as I told you, everyone is a piece of Swiss cheese. But sometimes people come in and say, I just want to get my hormones straightened out. I don't want the whole thing. Some people may want the entire holistic anti-aging program. So, from an anti-aging program standpoint, the first thing is assessment.
Okay.
So the assessment takes a while. We run physical tests like EKG, hearing, a memory test. I do a memory test on everyone because you want to know what your memory is at baseline.
That's right.
Not when you're found walking around Safeway and can't find your keys.
That's right.
So everyone has a baseline memory test regardless of age. So we do a complete physical exam. History is very critical. What's your family history? What's your past medical history? We can do genetic testing. A lot of people are worried about cancers in their family. We can run genetic testing. A lot of people have symptoms that don't seem to quite make sense to them or anyone else. Many people come to me after they've seen several doctors. So we do sensitivity testing. Okay. Is it something that you're eating that just doesn't work for you? People say, I have a lot of gas, I have a lot of, whatever it is. So we get all this data together, and then once we have all this information, now we give you a plan. And it's a written plan. It's something that you can follow from here on out and understand what issues you may have.
Yeah.
So I identify your concerns, the concerns that you came in with. I identify concerns that maybe you don't even realize you have or should have. And then we have a plan on how to deal with each thing.
I love the fact that you initially put each of your patients through a very comprehensive evaluation.
Absolutely.
And to really determine together as a team with yourself and the patient the best plan, the best customized treatment options that can really help them achieve their goals.
You're absolutely right, Rocco.
Dr. Tuakli, I'd like to now discuss some of the other services that you offer here at the Anti-Aging and Longevity Institute. And I wanted to ask you if you could please tell us a little bit about, for example, the hormone therapy program that you offer, because I know you touched on that a bit earlier, but if you could please elaborate some more, because it's providing a number of key benefits to so many folks. It's a very popular option these days.
Yes, so hormone therapy, the only kind of hormone therapy that I do is bioidentical.
Okay.
And bioidentical means that it is identical to what your body actually makes. And given that, all the scary stories and rumor that people worry about really doesn't apply, because these are things that your body naturally made. So I believe so much in bioidentical hormones that I've actually written some books about it. This is Lifting the Veil of Menopause, and this one is called Sex, Sanity, and Sleep. And this one has been translated into Spanish so that more people can take advantage of the information. So I love bioidentical hormones for a variety of reasons, but the main reason is that I see how it changes people's lives. I see people who have been depriving themselves of hormones because they think it's something bad or something scary, and they get to a point where they just have to come in and do something. And then a month later, they're different people, and the first thing they say is, I can't believe I didn't do this sooner.
Yes.
People always say, oh, I didn't think it was going to affect me, or I didn't have hot flashes, so I thought that it wasn't a concern. But I have a patient, the only thing that was a problem for her was a dry mouth. But she had a dry mouth, and she went to several dentists, she went to orthodontists, she went to oral surgeons, and nobody could help her. She was using over-the-counter biotin, this and that. And she said to me, do you think maybe the hormones are causing this? And I said, I can't promise you anything, but what I can tell you is that at your age, early 50s, chances are you need to get your hormones balanced.
Yes.
As soon as she started taking the hormones, she never had another dry mouth. But what was really nice is she will come and say to me, I didn't realize how many other symptoms I had. I thought I was okay, but now I see that I was just putting up with a lot of other stuff.
Yeah, so it really helps a lot of folks out there.
It does. And some people haven't slept for 5 years, which is just mind-boggling.
Yes.
But people say, I haven't slept in 5 years. I'm a sleeper. I love my sleep. I say, what? Memory. People's memories are going downhill, their fatigue level is through the roof, and they think that it's all part of aging and they have to put up with it. And it's all about the hormones.
Yes.
I mean, hormones are so basic to the human being system. If we could just understand that, then all this mystery and what people have about hormones would be demystified. And that's one of my missions, really. To just demystify this whole bioidentical hormone thing. It's natural. It's like taking vitamins. And so I wrote a book about it.
Yes, indeed. You're one of the foremost leaders in this field, in this region. Now, I know you touched on this a few moments ago, but if you could please be kind enough, Dr. Tuakli, to just elaborate a little bit more on who would be a good candidate for the bioidentical hormone therapy.
Okay. So what happens is the hormone levels gradually start to decline at the age of 35. Okay. Some people are lucky, it declines gradually, and some people are unlucky and it kind of drops off the cliff. For example, someone who has a hysterectomy and they take out the ovaries, it's like a light switch, boom, gone. But if you're lucky, there's a gradual slope. So in general, let's talk about women first. Around the age of late 40s, early 50s, a woman needs to have her hormones evaluated to see if there are ways that she could perhaps improve, not just taking estrogen. It's not all about that. It's about balance. It's about the balance between progesterone and estrogen. So sometimes a woman only needs to take some progesterone. She doesn't even need estrogen until she's much further into menopause. Unfortunately, there are some women who need help much earlier. And so I have hormone patients who are in their 30s. But the difference in their life that these hormones make is amazing. Also, there are some young ladies who are unfortunate because in their teenage years, they have major hormonal problems like difficulty with their periods that are so heavy, so painful, that they have to take weeks off school. And then, of course, there's PMS, which everybody knows about. Yeah. So some people have debilitating PMS. And these are all hormonal issues. And so when one talks about hormones, you have to think a little broader than just menopause. And then we have the menopause, which is andropause in men.
Yes.
Because men don't often realize that they too have hormonal issues. So sometimes the first sign of it in a man is erectile dysfunction. But then when he looks back, he starts to realize that things have been changing for a while.
Yes, indeed. So there's a lot of folks that can truly benefit from the hormone therapy.
Absolutely. And if you know someone who could be helped, then spread the word.
Absolutely. Now, what kind of results are your patients seeing? And again, I'm sure this depends on each particular patient, but in general, and we're going to hear from some of your patients in a few minutes, but in general, what kind of results are they seeing, Dr. Tuakli?
They do great. For some patients, it's actually life-altering. And that sounds dramatic, but it's so true. I mean, I could see a patient who comes in crawling almost red and just frustrated and can't hardly articulate what the issue is. And I could see the same patient a month later, and she's a different person. Now, one thing that I want to point out is that hormonal replacement, hormonal therapy, it's not all about women. It affects the whole family.
Yes.
So there's the old joke about the guy goes out and buys a red sports car and is having a midlife crisis. Sometimes that's a symptom of something going on with the wife, something going on with him. Families are separating. And I'll tell you a funny story. There was a lady, I started her on her hormones, and the next time she came in, she said when she's going to work in the morning and get ready and she's driving out the driveway, her son would come running and tap on the window and say, Mom, did you remember to take your medicine? So she realized it was actually affecting the whole family. Yes. She just didn't know it.
Yes.
And another lady told me, she said they had a puppy, and when she came home, the puppy would always go under the sofa. And I said, no, you're kidding. She said, no, I'm serious. The puppy would go under the sofa. I was that mean in the house. But she got on her hormones, and she said, now the puppy comes like any other normal dog, comes right to the door. Right. She comes through the door, and he comes right there.
Yes.
So there's so many anecdotes that I have, having done this for so long, that it's just amazing. Some of them are in the book, but I just love sharing them.
Thank you for sharing those anecdotes and telling us what you've told us thus far. Dr. Tuakli, we are suffering from an obesity epidemic, and go over an area which really is afflicting so many folks here in America, and that is namely an obesity epidemic in the U.S., which is unfortunately adversely affecting the health of so many people, leading to significant increases in diabetes, heart disease, and mortality. And you over here at the Anti-Aging and Longevity Institute offer a very highly effective medical weight loss program that is helping so many people not only lose the weight, but keep the weight off, which is even more important because there's a lot of fad diets and different things that have been out there for decades that come and go. People lose a lot of weight, but unfortunately, in most cases, they gain not only that weight back, but many more pounds on top of that.
Correct.
So your program here has been very successful in not only losing the weight, as I just said, but also keeping it off and improving your patient's overall health and wellness at the same time.
Yes.
So I wanted to have you please describe to us what that weight loss program entails, because it's doing some great work for a lot of folks in the community.
There are a lot of different things that you can do to lose weight. Obviously, everyone pretty much knows those. But one of the most successful methods of losing weight is the HCG diet. And this is a 6-week diet, and you will lose between 20 and 40 pounds. Now, I have a long lecture on it, which is on my website, and I'm not going to bore you with exactly how it works. But the HCG diet helps you to get rid of the bad fat. We have 3 kinds of fat in our body. One is the one that keeps us looking young, is under the skin, it protects our organs. There's another kind that you use when you run upstairs or you suddenly need energy and you burn that. But there is a 3rd kind of fat, which I call the bad fat, which everybody kind of knows is not supposed to be there. It's not normal to have a big fat pad at the back of your neck. the abdominal fat, the hips bulging, under the arms. So that's actually usually the fat that people are trying to get rid of. They just don't realize it.
It's that localized fat in parts of our body.
Exactly. So the HCG diet actually targets that fat. And what I like about it is that when people are on the HCG diet, or when they finish, they don't end up looking like a skeleton. Some people lose weight and they feel really good about it, and everyone keeps asking them, "Are you okay? Are you sick?" That's not the look you're looking for, right? So
that's an unhealthy look, actually.
It's an unhealthy look. And what's happening is you're losing the good fat instead of losing the bad fat. So they say, I lost 30 pounds, but I look sick and I still got this midriff right here. So, but the HCG diet doesn't do that. It actually loses the fat that you want to lose and retains the good fat.
Very interesting, doctor.
Yeah, the analogy is that you kind of have your fat stored in a vault and you can't get to it. So the bad fat is sitting in the vault and you're burning up all the good fat and you're not getting to where you want to. The HCG allows you to open the vault so you can burn the bad fat. And then you reset the thermostat so that the vault doesn't store more than you want it to. Because quite frankly, human beings are designed to avoid a famine. And in America, people laugh when I say, we are made in case there's a famine. But there are many places in the world where there's still famine.
That's right.
And so the human being is designed to hold on to that. So once you have the thermostat set too high, it's very hard for you to get rid of it. If that makes sense.
Yes, indeed, it does.
So the HCG helps you to reset your thermostat, lose the fat that you want, and then it helps you to maintain it.
And I would also imagine that the patients that come to you for your medically supervised weight loss program, just as with your other anti-aging treatments, the hormone therapies, and other programs that you offer here, that this too is also a customized, safe and effective supervised weight loss program that you offer. And I love the fact that you mentioned a few minutes ago, doctor, that it's approximately up to 6 weeks, depending on the patients, right? And his or her goals and what they're looking to lose. And I love the fact that you said it's generally or typically between 20 to 40 pounds is what your patients are seeing in weight loss. And it's the other key point that really has stood out to me on your weight loss program is you're absolutely right. It's the bad fat. It's the fat that just doesn't go away no matter how much we exercise. It's the tire around the stomach, the localized, hard to remove fat in other parts of our body, as you explained earlier. That it targets this fat and removes it safely and effectively. That's very impressive indeed.
Yes, I started doing this diet because the bypass surgery and other invasive procedures were becoming very common. And I would see people having their stomachs reduced in size or different, surgical methods, and they would lose weight, great. But then a couple years later, they put the weight on, and now they're the same size as they were before the surgery, except that their insides are all turned around.
Yes.
And I said, there's got to be a better way.
And that's
and so I started to do this diet, and people, like I said, they lose. I've had a patient who's lost, she did it about 3 times and lost up to 100 pounds.
Very impressive.
And she came off her oxygen. When I met her, she was lugging around an oxygen tank. She's off her oxygen. She's able to walk around, and no surgery.
Which is no, like you said, it's not bariatric surgery. It's not the other types where you basically just suck out a lot of that fat, which can have its own side effects in many cases, and it's an invasive treatment. Here, it's non-invasive. It's medically supervised. It's safe. It's effective, and getting some. And
I always believe surgery should be the last result.
Always
for anything.
Absolutely. Yes. Very well said, doctor. And again, I'm sure a good candidate for this weight loss program that you offer would be anyone that's looking to remove that bad fat that you described.
Yes, so the normal BMI, body mass index, should be less than 25. That might be shooting a little too ideal, but basically anyone who's having difficulty maintaining the BMI, particularly below 27, would be a candidate for the program.
Covers a lot of folks.
And it jump starts too. I mean, people do the 6 weeks, they jump start, and now they can run with it.
Yes.
So, I mean, it's a really good jump start.
Welcome, Reggie. It's a pleasure having you on our program.
It's a pleasure to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, Reggie, I'd like to begin, if I may, by having you please tell us what problem or problems were you experiencing that brought you here to Dr. Tuakli?
The reason for visiting Dr. Tuakli was I was experiencing lethargy, general tiredness, and just not feeling myself. And I had a feeling it was age-related. As I'm getting a little older now, I need to be more concerned about my health. So I decided to pay her a visit.
So then what happened once you came here?
She decided to run some tests to see what could potentially be the underlying issue. I had to fill out a questionnaire. Once the questionnaire was filled out, we ran some blood tests, and she was able to determine a few underlying issues.
So you went through that initial evaluation process, as you just described.
Yes.
And then what took place as far as what you had done?
So after reviewing the results, she discussed them with me and gave me some options. The options would be to increase certain levels of hormones, some over-the-counter and some that would be administered here. Yes, so and I decided to do that because that seemed to be a logical path to curing whatever was bothering me.
Yes, indeed. So you went through the hormone therapy?
Yes.
And how do you feel now?
I feel 100% better, a lot younger. I feel more energetic, and my sense of overall awareness has returned.
So as far as your overall experience here with Dr. Tuakli and her staff, for the folks out there watching, what would you tell them?
I would highly recommend Dr. Tuakli because she's extremely professional. Her staff is very supportive, and she's very caring and very endearing. I highly recommend her.
Well, on that note, we'd like to thank you, Reggie, for joining us and being a guest on our program. It was a pleasure having you on.
Pleasure being here.
Thank you.
Thank you.
Welcome, Carol. It's nice having you with us today as well.
Hi, thank you.
Now, I wanted to begin by asking you, Carol, if you could please tell us what initially brought you to Dr. Tuakli.
Well, I guess about a couple of years ago, I noticed that my skin was changing. I had what was later diagnosed as rosacea and eczema, and it just got worse. And I had been to a few dermatologists, and no one had any answers other than, topical ointments to put on it.
Sure, and obviously they weren't getting the job done because that's why you came to Dr. Tuakli, right?
Yep, absolutely.
So then what happened once you got here?
Well, I had known a little bit from being in the business about bioidentical hormones, so I kind of had an idea a little bit that I wanted to try them out. Okay. And so she did an evaluation. She did find that I needed some bioidentical hormones by doing blood work and saliva work. And then after about 3 months, my skin cleared up. Pretty much. It was very exciting. Yeah.
Your skin looks great, by the way.
Thank you.
So this was through the hormone therapy that you went through for about 3 months.
Right.
And then you saw some very impressive results.
I was so happy, yeah.
That's great. And for the folks out there watching, Carol, what would you like to tell them or share with them about how your experience has been, not only with Dr. Tuakli, but the staff here as well?
Oh, it's been really great. She took such an extensive history and included all of the symptoms, emotional well-being as well. And in fact, every time you come into the office, the cool thing is that you actually go through a checklist and evaluate how things have changed since the last time you have been in. So yeah, that was really neat. And Esther, who works here, I love so much. She's really great.
That's wonderful. And before we let you go, Carol, for all the folks out there watching, Would you recommend Dr. Tuakli and the Anti-Aging and Longevity Institute?
Oh, I have been already. Yeah, I've sent many people to her already. Yeah.
Wonderful.
Yeah.
Well, on that note, we'd like to thank you as well for joining us, sharing some of your experiences, and being a guest on our program.
Oh, yeah. You're welcome. Good to be here.
It was our pleasure.
Okay.
Natalia, what problem or problems were you experiencing that brought you to Dr. Tuakli?
Окей, депрессия.
I was in depression,
И эта проблема у меня с моего подросткового возраста.
and I have had this problem from my teenage years.
Но в течение всех этих лет я могла как-то с этим справиться.
But during all these years, I could kind of manage it.
Но в какой-то момент мое тело сказало, все, больше дальше нельзя.
But there was a specific moment when my body said, "That's it. It's the end of it."
И я оказалась в очень глубокой яме.
I was in a deep pit.
Когда мне было
I was
35-36,
about 35 or 36 years
но
old.
я чувствовала, что вся моя жизнь подошла к концу,
But I felt like my entire life is over.
и меня не ждет больше ничего хорошего,
There's nothing ahead of me anymore.
я ничего не могу,
There's nothing I can do,
я ничего не чувствую,
and there's nothing that I feel.
я не могу послужить своей семье, хотя я их очень люблю, моего мужа, мою дочь,
I love my husband, my daughter,
но я оказалась в ситуации, когда у меня не было сил что-либо делать.
but I was in a situation where I had no strength to do anything whatsoever.
Я испытывала очень много вины и страха,
There was a lot of guilt and fear.
So when you came to Dr. Tuakli, Natalia, what took place? What did you have done?
Когда мы пришли к доктору Туакли, во-первых, мне задали очень много вопросов
When we first
о моем
I
состоянии.
was asked a lot of questions about my condition,
И я хочу сказать, что доктор Туакли очень внимательный, очень чуткий человек.
and I want to say that Dr. Tuakli is a very attentive and very sensitive person.
И я очень зажатый человек и не всем доверяю.
And I am very closed as a human being, and I do not trust too many people.
Но с доктором Туакли я почувствовала полную свободу, и у меня появилась надежда, что этот человек может мне помочь.
And with her, I felt a complete freedom, and I had a sensation that this is probably the person that can give me hope.
Поэтому я рассказала то, как я себя чувствую, мы обсудили все мои симптомы, и
Shared with her how I felt, and we discussed all of my symptoms with her.
затем мы прошли через серию анализов,
Then there was some testing done,
на основе которых доктор Туакли прописала мне определенные лекарства,
and based on those testings, she gave me the prescriptions.
гормональные лекарства.
It was for more prescriptions.
И я хочу сказать, что самый первый день, когда я стала их принимать, я почувствовала себя намного-намного лучше.
And I want to say that the very first day that I started taking the medicine, I felt a complete difference right away.
Чтобы определить, что нужно твоему телу, в чем проблема, какой дисбаланс произошел с твоими гормонами.
To find out what exactly happened to your body, what disbalance, what exactly is needed for your specific problem, what happened to your hormones.
Но когда мы определили это все, и мое тело стало получать определенные гормоны, в котором оно нуждалось столько лет,
But when we discovered all the problems and my body started receiving the hormonal balance, hormonal supplement that it needed for such a long time,
мое тело начало постепенно восстанавливаться.
my body started to be restored slowly but surely.
So how do you feel about the results?
Я замечательно себя чувствую, спасибо.
Thank you. I feel incredible.
На самом деле это для меня началась совершенно другая жизнь.
In reality, I have a brand new life.
Потому что те вещи, с которыми я боролась всю мою жизнь,
Because
с какими-то...
the very things that I've been fighting my entire life,
Мне казалось, что это черты моего характера, что это я такой замкнутый человек, у меня очень низкий уровень энергии, меня ничего не интересует.
I felt that this is a part of my character. I'm such a closed, introverted person, and I am not interested in many things. I just don't have the energy levels required for certain things.
И очень эгоистична иногда.
And sometimes I was very egotistical according to my feeling.
Для меня это на самом деле было большим откровением и сюрпризом, то, что часть виновата в этом, не только я сама, но и мои гормоны.
but for me it was a surprise and a revelation at a certain point that partly it's not my character, it is also hormonal fault.
И сейчас, когда уровень гормонов восстановился, и есть этот баланс в моем теле, я чувствую себя замечательно, у меня совершенный покой внутри. Ушла депрессия.
When the balance is restored and hormones are dwelling in my body where they're supposed to, I have peace inside. I have no anxiety left, and I feel completely different. I feel great.
So then on that note, we'd like to thank you both for joining us and being a guest, and you can add whatever you like.
Thank you,
Very
guys.
great.
It was a privilege.
Welcome, John. Thank you for joining us today.
Thanks for having me.
Now, I wanted to begin, like I did with the other patients that were on prior to you, John, by having you please tell us what initially brought you to Dr. Tuakli and the Anti-Aging and Longevity Institute.
Oh, that's easy. I was overweight. At first, I was about, I guess, 30, 35 pounds overweight. And a friend of mine, good friend of mine, has had a great experience with Dr. T. I call her Dr. T.
Oh, okay.
And he said, you got to try this. She's a great person. Her procedures are outstanding, and they work. So I gave it a shot. It's called the HCG diet.
Okay.
And I lost 35 pounds.
Good for you. Congratulations.
And it was awesome. It actually reset my whole body. So my cravings for sweets and certain things like that and the not so good foods kind of disappeared. Now, it took some time, about 9 weeks, but it worked. And I've kept weight off.
That is very important.
It's been 3 years and the weight just has not come back. So it's a really good testimonial.
Absolutely. We're very happy to hear that from you, because a lot of folks, when they try the different diets that are out there and the different weight loss programs, in many cases, when they do lose weight, that we see and read about all the time, unfortunately, too many times they regain not only the weight they lost, but in many cases they actually gain more weight back. So the fact that you kept it off for 3 years and counting, and that's great news.
Yeah, they need to try this new diet.
Yeah.
The
So
other
this
ones don't work.
diet here, Dr. Tuakli offers, obviously has done wonders for you.
And a lot of other people that I know. So it's not just me.
Yeah.
But it really has kept it off and trained your body what to do and not to do. So you don't have the craving. So that makes it a little bit easier for me.
That's a key point.
And that kind of got me moving to Dr. T. And then I was tired, had problems sleeping, issues with energy, also memory. And then I entered into the hormone therapy with her. And I got pellets, they're called testosterone pellets. And boy, that, within a couple weeks, I saw a change. About 2 weeks, I saw a difference in my energy level. You became clearer, sharper, body tone. The weight I lost, I was able to tone that through the hormone therapy.
Wonderful.
It really made a difference. And I've been doing that for about 2.5 years now, the hormone therapy.
Look at all the energy you have. My goodness, look at all the weight you've lost.
I need it.
Yes.
I need the energy, actually.
So you went through both of those different options here, not only on the safely and effectively losing the weight, which you've done and kept it off all these years later, but also the hormone therapy has really helped you quite a bit.
Absolutely. The energy, because I work for Youth in Christ, and it's a bunch of youngsters. Can you imagine trying to keep up with all these younger people? Yeah. So that gave me the energy to be able to do the retreats and to be able to hang with these guys, to stay up late and do what I need to do to help them through. So it's made a big difference.
Well, we're certainly happy to hear that, John. And before we let you go, if you could please tell us what your overall experience has been like, not only with Dr. Tuakli, but her staff here as well.
Oh, that's great. I'll tell you, working with Esther, Cindy, and Dr. T, the three of them, it's like the trifecta. It's perfect. Those guys hand off to each other so well. I mean, Dr. T and then Cindy will step in. Esther's great at drawing blood. I don't know if she ever missed, by the way. She's fantastic. Yeah, and the personalities.
Yes.
It's perfect. You guys would love her. I mean, whoever's going to come, they're going to have a great experience. I can tell you that.
And on that note, we'd like to thank you.
You're welcome.
For joining us, being a guest on our program. It was a pleasure having you.
Thanks for having me. I appreciate it.
I must say the patients are very happy with the results. Some great work indeed, doctor.
Thank you.
Now, we've only got a few minutes left, Dr. Tuakli, but I wanted to also have you talk a little bit about the family medicine component of your practice here.
Okay.
Can you please take a few moments and tell us about some of the services that you offer and who's a good candidate for that as well?
Okay, so I'm board certified in family medicine, and I do enjoy treating people of all ages from the cradle to the grave. And so I can basically take care of anyone of any age. I do preventative medicine, I do curative medicine, I do what most primary cares do for my individual patients, but obviously I provide a lot additional services that many primary cares don't.
Yeah, you just talked about until this last segment, because when you really think about it, you have an integrative practice here,
Right.
Covering a wide range of modalities to the benefit of the community and so many in the region. And I love the fact that your family medicine practice as well utilizes that integrative health and wellness approach with
Right.
each of your patients. And as you just said, from cradle to grave and everyone in between, right? Basically.
Yes. A lot of people are surprised that I love taking care of babies as well, but I really love my babies. I can see the boards all over the office of,
Yes.
of babies that I've taken care of. Most of them have graduated now with babies of their own. But the beauty of family medicine is that you get to experience the entire lifespan of an individual, and also how they relate to other people in the family. So I have babies, I have grandmas, I have couples, or the lady comes, she brings her husband, then they have a baby, then they bring their parents. And so I have some families, I actually have 4 generations.
My goodness.
Because I've been working for so long.
Yes.
And last week I had 2 of my 93-year-olds coming in just for routine checkups. And they're totally with it. I mean, they have all their faculties.
Yes.
And they let me know what generation they are too.
I appreciate
They
you.
put me in my place.
Yes, indeed. I appreciate you sharing that with us. And before I let you go, Dr. Tuakli, I just wanted to say you have achieved a reputation for excellence in providing effective anti-aging treatments. You're helping so many patients over all these many years improve their overall health as well as their wellness. And most importantly, I would say, you're doing it with a wonderful patient-centric focused practice where you really prioritize each and every one of your patients, not just you, but your staff here, as we heard from some of the patients. They love all of you here. And you really do, if I may use this old cliche, but it certainly applies here with you and your practice, you really do treat each patient like family, like we all would want to be treated.
As an individual, correct.
When you think about it, absolutely. So I just wanted to ask you what you feel really helps separate you and your practice apart from the others, because you have people throughout the DMV region that are coming to your 2 locations, not only here in Columbia, Maryland, but also you have a second location in Laurel, Maryland as well.
Well, I like the way you phrased that, Rocco, because the disease-centric model of medicine is outdated.
Yes.
And we have to move forward with a wellness model, as opposed to I'm sick, I go to the doctor, or the inevitability of being sick. And so I start with my patients from whatever age they present to do a wellness model, a holistic wellness model. In some ways it seems revolutionary, and in some ways it seems basic. I believe in practicing common sense medicine.
Yeah.
So there are lots of fads in medicine, and they come and they go, and if it doesn't make sense to me, I don't buy into it, because it will go right around and come back to where we are. I believe in taking care of each and every patient as an individual, and I'm passionate about what I do. So I feel that it's a privilege to be able to be involved in patients' lives and to be able to contribute to their wellness and happiness and energy and vitality. And if those are things that appeal to you, then you should find yourself an anti-aging doctor.
Yes.
Because let's take a leap to the future of medicine, and vitality, enjoying life, that's what it's all about.
Absolutely.
And wellness, of course, and health.
Yes, indeed. And on that note, I'd like to thank you for joining us, being a guest on our program. It was a privilege to have you on with us today. You are an esteemed doctor in these modalities that you've told us about and educated us about today that are benefiting so many folks throughout this region. So it was really great having you on, Dr. Tuakli.
Thank you, Mr. Ferrari.
And we would love to have you back on in the future.
It'd be my pleasure.